Hi everyone, I'm Ivana, part of BU COVID Core's video production team. This week's episode is going to be a bit different because we want to acknowledge that March 2020 was the beginning of the pandemic for most of us here in the US. Since we're at the 1 year mark, we'd like to take a step back and reflect a bit on what this milestone means, how we're faring now, and what might happen in the future. Joining us today is Boston University's student-led It Won't Cut It initiative. Lesley, tell us a bit about yourself and what the initiative's been doing these days.
Hi, Ivana. So I am a senior majoring in health science with the hope of becoming a physician assistant. So I'm on the pre-PA track at BU. I am also one of the co-team leaders for the health and science team for the brand It Won't Cut It, where we just meet up with people that are interested in learning more about COVID and also just fact checking some of the rumors and things that are posted in the news just so that students are more informed.
Nice, awesome. Well, thank you for joining us today.
Thanks for having me.
Well, it's March again. I don't think anyone really expected any of what's happening to go down. Where were you March last year?
I was actually, so it was our spring break, BU spring break, and my boyfriend goes to Northeastern, so they had just gone back to school, but we had spent the weekend together. And it was actually crazy because he was kind of like moving out of his dorm at the same time that all this was happening, because Northeastern had initially said like, hey, like you'll be able to stay on campus, like we'll keep the building open during this whole thing. And then they changed and were like, no, you have to be out within 2 days. So he was in the process of like moving all this stuff out, and I was kind of just like secondhand witnessing it. And it was just like this really weird feeling. And even when we got to the airport, we were kind of like, do we wear masks, or we just like bought some in like the gift shop and wore it on the flight? But they were just like the surgical masks, like it wasn't anything crazy. It was just like a very weird feeling. And after I came home that weekend, it was my brother's 18th birthday.
Oh no.
Like, following Monday. So it was just like, the mall is closed. I cannot get you anything. Like all at this point, like all the online stores were also closed because everyone was trying to reevaluate and take a step back and see like where are we going with this whole thing.
No, definitely. I get that uncertainty. When a year ago, today actually marks the 1 year of me being back home for spring break, because I'd come back home to Florida. And while I was there, I made the decision to stay at home instead of like risking the travel, just all of that uncertainty piling in, just like you said. Like, you don't know what you should do or what you can do. And I've been here the whole time. I haven't gone back to Boston, and I don't know what it's like in the larger city. And I can't imagine what it's like to kind of be stuck in the BU bubble right now, or having to be a student that's forced to be on campus. Because I remember, when all of the universities started shutting down because of the uncertainty, and then it kicked back in to full capacity or partial capacity the following semester. So whether like people are starting or graduating, it's really been kind of we're not really sure what we're doing. And I feel like it's still going on, that we don't know what we're doing.
Yeah, I feel like the exact same way. Like I felt bad. So last year my brother was a senior in high school, and I felt bad for him graduating and not really getting like that last senior year hurrah. But I feel even worse for myself graduating, because I've done this for 1.5 years. And even though BU is announcing an in-person graduation, it's still not going to be the same. And I think it's going to kind of mess with everyone's head, especially like when you get to after graduation. It's like, what's next? Like, you don't really have a summer to look forward to, because travel is going to be interesting and whatnot. But I think there's just like a lot of stress that's going to now come with graduating and COVID.
For sure. I'm sure a lot of people expected things to be better by now, but no matter where you are, really, there's not a certain this is going to happen or future. And things like travel, that's going to be complicated, because you see people going out and doing stuff, but you know that things aren't as normal as they may seem to be, no matter how people present themselves. And then there's that frustration of also wanting to present like you're having a good time and living your life as you expected to, but then having to like rein it in for your safety or for the safety of the people around you.
Yeah, I definitely feel like I kind of even had this conversation with my boyfriend today. I was like, do people just like not think of COVID when they travel or like go anywhere? Like I have just so much anxiety and stress, which is obviously increased because of the pandemic, that like I could probably not, I don't leave my house without worrying about something.
Yeah, no, even just going to the store and seeing people around you, if you go like during busy hours too, it's definitely a shock. I think because we were used to just being out and doing things, and then all of a sudden not being able to, and then having to in some capacity go back. Like people who are like register workers, or who necessarily have to be like sanitation staff, or people who in like hospitals, for example, like hospital staff, healthcare workers and nurses are one part of it, but then everyone else who has to keep the hospital running, like kitchen staff as well, like what's it even like for them to necessarily be active, and they never got to stop.
Yeah, I honestly, like, sometimes I get down about like my situation, but I also realize that there are people worse off than me, and there's people like better off than me, and that's kind of like how toxic like social media can be in that sense, is that like it shows you the best portions of life rather than like the realistic ones.
Yeah,
even
like
though I think
you're allowed to not care.
Yeah, exactly. So like, even though I think social media has definitely provided a space for like some short-term gratification, or just like things that like you're hoping to look for, because there are times where you just like need something, like you need to see a puppy video. But then it's like, okay, well, I don't have a puppy. This is not gonna last. Like, I want an emotional support animal. And I mean, that's even just like things that like it definitely gets people's mind off of things, and they're able to learn certain things on videos, like in TikTok especially. But it's a lot of the times it's just also not realistic.
Yeah, no, it really just builds up a false sense of expectations for how we're supposed to be acting these days, especially with like, I feel like that feeds into the misinformation, because one thing is concrete false information where it's just not true facts about the virus or the pandemic or the state of things, and then it's how things are perceived by social media. Because if you do see people just posting, I'm on vacation pictures, or we're out at a restaurant, or I'm at this big party or a wedding, even if it's not something right out saying the pandemic is over, it makes it feel like it is, even if it's not. And just the fact that places have to be open because of whatever regional legislation that they're under, or just trying to stay afloat, economically. Where's that balance? It's really hard to strike it. And we all want things to come back. We all want things to open. But I don't know. I don't know what the answer is. I don't think anyone really does.
Yeah, because then you're kind of like, everyone's kind of left with this decision of either like going down in a lockdown once again, or avoiding another wave of infection, especially with the variants that tend to have higher infection rates. And then you kind of worry about like, what is the value of life if we were to just go on full lockdown again, rather than like leaving things open and trying to like see cases go down, cases go up, and cases go down, like etc. But even if we were to go back into like lockdown, or even not, just with certain conditions, like that affects like the people that are back living at home. Like, how do they figure out housing? And I think that also can affect like school, and how they're supposed to, if this is like a long-term thing, like how we need to fix our plans. Because I know a lot of people, including myself, like expect it to be this short-term thing, like, okay, a year, okay, 2 years, and now sometimes it just feels like the deadline keeps getting pushed back more and more. And I think like it's definitely going to have to come with some readjusting.
Yeah, especially considering how we're just one part, we're just one cog in like all of this, because the United States is one thing and then the rest of the world is another. Like it's not really over until it's over for everyone in this sense, which is a little bit generic, but it's true. And everyone has to adjust their plans. Like I'm graduating to go into the workforce, and like I expect to do okay, I guess, in the job search, because I have studied public health. It's a relevant field right now, and there's a lot of demand, but I can't imagine what it must be like for someone to be somewhere looking for work in a field that's pretty stagnant right now, just because of how things are, or how they have been. Just the recuperation that it's going to take economically for things that have been closed for the past year, it's going to be difficult. And being entry level in those industries is it's just got to be tough.
Yeah, I mean, like even people just like having plans that were kind of predetermined, including myself, just as a pre-PA major, I was like, okay, I'm going to take a gap year. I'm going to be doing volunteer stuff, getting my nursing assistant license, and like even just like, or even taking prereqs, like all of those things were already pushed back because I was supposed to do them last year. Mm-hmm. So even though that like they are plans that I have in mind, like COVID can still mess up those plans, unfortunately. So I feel like all of us that are graduating from college, whether it just be undergrad or grad school, are kind of like in this one boat trying to navigate the seas of life, especially in times of COVID.
Yeah, we're really just groping around in darkness. Like nobody has the experience for what's going on right now.
Yeah.
Like there's really just no social memory, I guess, of what's happening right now, because things like this have happened in the past, but I don't know. It's like the world has changed since the last time anything like this has actually taken over everyone's daily life, that we can't really predict what's going to happen. And I'm personally very thankful for my situation. Like all things considered, I'm doing very okay. The people around me are safe and healthy. But it's just the grim reality of knowing that some people have lost their entire families.
Yeah.
Or their careers have just combusted and imploded. There are people who have been displaced from their housing totally for no fault of their own. How do you justify what's going on for those people? It's kind of insane how it's very dehumanizing, I think. Places open up with no regard for what's taken place. And again, yeah, there's not really any answer for that, I think.
Yeah, and I think it's definitely hard, especially for those populations that are kind of outside our BU bubble, and even just like, I think college bubbles in general. I know BU is pretty good when it comes to like COVID testing regularity and monitoring its students, which they obviously have to, and even like with vaccines, but there are just some people that live in areas where they're not able to access that kind of stuff. And unfortunately, like it does bite them in the butt, because whether or not like they're getting tested enough, or even like where they are in terms of like getting the vaccine, or how they'll even know if they're going to get the vaccine and when.
Yeah. Oh man. Yeah. Vaccination. That's really been another juggle on its own too, because as far as I understand, like the vast majority of places have been prioritizing the elderly, for example, and other vulnerable populations. And I know for my family, we've been trying to get one of my grandmothers her vaccine. And the way they've been distributing it in Florida, it's been very difficult to get a spot in the first place. Second of all, to get a spot near us. And it's been, my mom has been regularly going online early in the morning to get just a spot in the line. And the forms you have to fill out and how long they are, and just the fact that you have to use a computer and have good internet to be able to even do that in the first place. It's like, I just can't imagine someone 85 being able to do that easily on their own if they didn't have someone.
Especially since they're like the population that need it the most. Or even like for immigrant populations, I think like in rural areas where it might be hard for them to access those resources, especially because COVID-19 has been hitting Black, Indigenous, like people of color like so hard, because they already lack those resources as it is. And it just like added fuel to the flames, unfortunately.
Yeah, it's really made the lacking infrastructure and social support just completely highlighted, more so than ever before, I think, because it's been affecting every aspect of their lives and of society too. They do a lot of the front-facing work that has been, I guess, qualified as essential. And they're not really acknowledged in that regard, where it's like, yes, we are putting you out there, a little bit more of a sacrificial pawn than an essential worker. It's changing the definition of what it really means to be an essential worker, I think.
Yeah, it's almost like they twist the narrative to being a hero, when they are also not even being paid minimum wage.
Yeah.
Well deserving. Or even just like a living wage in general, especially for those populations. But they'll give you the title of a hero.
Yeah, it's scary. It really is to be said, yep, we need you, but we won't compensate you for what that actually means.
Yeah, exactly. And I feel like that's where I think like a lot of people within the college bubble, specifically the BU bubble, kind of have to be like very grateful for the spots that they're in. And I'm extremely grateful. I was in one of the first phases of BU's vaccine distribution. So I actually just received dose number 2 a couple days ago, and I am completely blessed to have that opportunity, especially because I know that there are those that don't have that opportunity. And as stressful as it is leaving the BU bubble, I'm definitely thankful for being a part of it during this pandemic.
Mm-hmm. Well, this conversation's been super cathartic. Clearly there's a lot to digest here. Even if we're not 100% sure where the future's going to take us, I'm sure one day we're going to be able to understand what's going on and have lessons learned for everyone. Lesley, thanks again for joining me today. It's been great having you. Thanks everybody for listening. We hope you're all safe and healthy, and tune in next time for some more information.